transesophageal echocardiographic guidance for asymmetrically shaped stent designs. This is from the group from Kiel, Germany, and it's Dr. Hinges.
It's Lucien Lozanci presenting for Georg, who could not be here. I'd like to thank the program committee chairs for the opportunity to present our data in this forum. This is the author's conflict of interest. From several mitral valve stent designs, a few of these have already passed the preclinical stage with first-in-human implants performed in the past 2 years, and most of them recently, actually. Our mitral valve stent prototype, many of you are familiar, involves an atrial frame, a skirt, a ventricular body, and apical fixation with tethers is the means of anchoring below the annulus. So this study, it looked at apical fixation only with tethers, and then tethers plus subannular fixation with nitinol elements, which not very shown very well in the picture. There were 20 animals, and 10 in each group, and this was the valve was deployed on the echocardiographic guidance only, which was successful till we were successful to use until now with a very symmetric prototype. As you've heard, the echocardiographic has many advantages over fluoroscopy, and that's proven to replace a lot of fluoroscopy. This is a 2D and 3D echo assessment of the native mitral valve, and you can actually assess the mitral valve, the LVOT, and the apex as well in the same view when you access it. And this is transapical access, the delivery sheath with the valve, and allows for centering of the device in the middle of the annulus, as well as providing the annular plane. The stent deployment here is the valve is partially deployed, and further small adjustments allow for corrections before final deployment. This is the atrial view of after the final deployment. And then 3D can assess the correct adequate stent positioning into the annulus on long axis, and 2D. We successfully implanted 18 out of 20, and only 8 in the subannular fixation group. The rotational assessment was difficult to assess under echo, and again, the subannular fixation was obstructed by the metal frame. We thought the echo guidance is adequate for deployment and positioning. However, is inadequate for assessment of the further elements in the subannular plane. Fluoroscopy provides instantaneous information about deployment, and it's important in especially difficult situations. One words about the first-in-human with TMVR. All performed first-in-human. Tendyne performed only 2 acute studies, after which patients underwent surgical replacement, which was planned for those patients. To date, 9 patients would have chronic implants, and 8 of them were implanted since the beginning of the year. 4 of those are alive. And just 2 weeks ago, Cardiac implanted their first human transapically and with their second-generation device. And I'd like to stop here. Thank you.
Good to have a seat here.